Businessman A is known for his misogynistic views. He frequently posts hateful comments on online anti-feminist communities, and openly discriminates against women in his company, refusing to hire female employees, no matter how qualified they are. One day, Mr. A rushed to the emergency room with severe abdominal pain. He was diagnosed with ulcer perforation. Emergency surgery was required to save his life, but Mr. A demanded to make the entire surgical team consists of male doctors. If not, he wanted to be transferred to another hospital, or refuse surgery. The hospital is faced with a difficult dilemma. Should they respect his request and assemble an all-male team? Should they go against his wishes and assign the available surgical staff including women? Or should they transfer him to another hospital, risking his life?
These days, the amount of female student in medical college is around 30 to 40%. In the past, female doctors often specialized in fields like family medicine, internal medicine, pediatrics, or obstetrics and gynecology. But now, more women are becoming surgeons, neurosurgeons, and even urologists, fields once considered male-dominated. Patients' attitudes have also changed. It used to be common for pregnant women to visit female OB-GYNs early in pregnancy, but switch to male doctors for delivery. Now, the opposite is often true. Many women strongly prefer female doctors throughout their pregnancy and delivery. So much so that male OB-GYNs are finding it harder to get jobs. According to a 2016 survey, only 10% of adult patients said the doctor's gender mattered to them. Some patients also check a doctor's background, where they went to medical school, which hospital they trained at before making a choice. But how society reacts depends on the situation. If a white supremacist insists on being treated only by a white doctor, most people would frown. But if a teenage girl requests a female OB-GYN, most people nod in understanding. If a Christian man requests a male urologist for religious reasons, many would respect that. But if a male patient says, "I don't trust female doctors because they're too emotional to perform surgery properly," far fewer people would agree. Then, we have questions. Does a doctor's gender or academic background actually affect medical outcomes? In fact, studies show that patients treated by female physicians often have better outcomes in the US, among patients aged 65 and older. Those treated by female internists had a 0.43% lower 30-day mortality rate, and a 0.55% lower readmission rate compared to those treated by male internists. Among surgical patients, the 30-day mortality rate for male surgeons was 13.9%, while for female surgeons it was 12.5%. Then, how about academic background? Academic background showed no meaningful difference either. A study comparing physicians from top 10 U.S. medical schools with those from lower-ranked schools found no difference in patient mortality, readmission rates, or outcomes. Another study showed that doctors from foreign countries had equal or slightly better patient outcomes compared to physicians who graduated from college in US. If the hospital honors A's request, it risks legitimizing discrimination. If they ignore it, Mr. A might refuse treatment and die. Yet, biases like these still shape real-world medical encounters every day. Should hospitals respect discriminatory patient demands in life-threatening situations? Or should they hold the line and refuse? Leave your thoughts in the comments below.